Bonjour à toutes et à tous. Bienvenue à ce point de presse du premier.
Hello, everyone, and welcome to this press conference with Premier François Legault, Health Minister Christian Dubé, and National Health Director Dr. Horacio Arruda. Mr. Premier, the floor is yours. Hello, everybody. Listen, like all Monday nights, I had an excellent meeting with the INES experts and the INES-PQ experts and experts from public health as well. And I'll start with good news. First, here in the national capital, the situation has greatly improved. We believe that in the next few weeks there will be a decrease in hospitalizations, so that is good news. The situation is improving not only here in Quebec, but also in Lévis, Bellechasse, Montmagny-Lillet. So in these four places, Quebec, Lévis, Bellechasse, and Montmagny-Lillet, I'm very pleased to announce that as of next Monday, the 10th of May, high school students will go back to school. Same thing like in Montreal. That means secondary 1 to 2 full-time, secondary 3, 4, and 5 alternating days. We will, next Monday, the curfew in those four places will go to 9:30 instead of 8, and non-essential shops will be able to open. So I'm taking this opportunity to say thank you to the citizens of these four regions who have made efforts over the past few weeks and who have helped us get the situation under control. In the Outaouais, the situation has improved when we look at the number of cases, but it remains very fragile. The great majority of the beds that are reserved for COVID patients are occupied. So all we'll do next Monday is that we will open primary schools in all of the Outaouais region. However, in the MRC Vallée de la Gatineau and Papineau, so where things are going better, we will put in the emergency measures will go to the red level. So that means in the MRC Vallée de la Gatineau and Papineau, the high schools will reopen and the curfew will go to 9:30, and non-essential businesses will be able to open. So next Monday, only in the two MRCs that I just mentioned. In the others, we are still with the emergency measures. In Beauce-Etchemin, there's truly 3 MRCs where we have problems, where there's still a lot of contagion: Beauce-Artigas, Robert-Cliche, and Les Etchemin. However, public health agrees to open primary schools. That is the only thing that we will change in Beauce and Les Etchemin. Right next to these two sub-regions, there's one region that's in the Estrie region. It's called Granite. It's near Lac Mégantic. And there it's become the place per capita where there's the most active cases. So it's very worrisome. So the entire RLS in Granite will go to emergency measures as of tomorrow night at midnight. That means that non-essential businesses will have to close. The curfew will be at 8 p.m. And unfortunately, we have to close high schools, and there will be remote learning only. In the Bas-Saint-Laurent, the situation remains difficult, so no change to the measures that are already in place. And I will end with good news. The situation has truly improved in the Abitibi-Témiscamingue. Next Monday, the Abitibi-Témiscamingue will go from orange to yellow. Elsewhere, the situation is stable and under control. So while Quebecers are making efforts to reduce contacts, vaccination is going on, and what we hope over the next few weeks is that the regions will go from red to orange, orange to yellow, etc. But it has to be done very gradually. I know that restaurant owners are very anxious to go to orange. And actually, I'd like to take this opportunity to ask Quebecers who are able to do so to order takeout from restaurants who offer it. I think that would, well, first of all, it would help the restaurant owners financially, but it would also help the morale. But we hope that in the next few weeks that we'll be able to bring many zones to orange so that we can open restaurants. So you may have noticed we're in May. We had said that April would be dangerous, and I think that we're doing quite well, very well. When we compare ourselves with, example, to Ontario or Alberta, we have half as many cases and hospitalizations as Ontario and Alberta. So that means that we are starting the month of May, and we're in good shape. And once again, I want to thank all Quebecers for their efforts. I know that we are fed up. Everybody's fed up. But I think that things are starting to look up, and we should have a nice summer. But the key, of course, is vaccination. Christian announced this morning that those who want to get vaccinated without leaving their car will be able to do so. We will start with the airport in Dorval. And I want to take this opportunity to congratulate Christian and his team, the vaccinating team. I'm very proud when we compare ourselves once again to what's being done elsewhere. And up until now, one of the keys to success has been that Quebecers, older Quebecers, when their turn came up, they went to get vaccinated. So among the older people, we've already reached 75% of the population that's vaccinated. Our challenge is when we open up the other age groups, the younger age groups. We also need to get that 75% vaccination rate. So I want us to be inspired by our elders who answered the call. It's an essential condition to be able to see our families again, to see our friends, to have, dinner parties on Friday nights. And I would love it, and Christian as well, I would love it if Quebec would be one of the places in the world where citizens have the greatest rate of vaccination. That would allow us to have better herd immunity. So if some of your friends or family members are hesitating, please try to convince them. Otherwise, ask them to go see their doctor, to go see their pharmacist, so that we can answer their questions, because the vaccines are essential if we want to have a nice summer.
Good afternoon, everyone. The situation is improving in the region of Quebec. I'm happy to announce secondary students or high school students will go back to school on Monday. Also on Monday, the curfew will be at 9:30 p.m. Non-essential businesses will be allowed to reopen, so I would like to thank people from Quebec for all their efforts. In Outaouais, the situation is improving, but it's still very fragile. Primary schools will reopen next Monday, and in the Vallée de la Gatineau and Papineau, MRC will return to red zone. This means that secondary schools will reopen. The curfew in those two MRC will be at 9:30, and non-essential businesses will reopen, but again, only in these two MRC. In Beauce and Etchemin, there are still a lot of active cases, so the only thing will reopen on Monday will be primary schools. We also have a region with a lot of active cases in Estrie, the region of Granite, including Lac Mégantic. We're forced to apply emergency measures starting tomorrow night at midnight, so non-essential businesses will have to close, and the curfew will be at 8 p.m., and unfortunately, secondary schools will close. Good news, the situation has improved a lot in Abitibi-Témiscamingue, so the region will now be in yellow zone starting Monday. In the meantime, we continue to vaccinate more every day, and we're getting closer to normal lives, but if we want to get there, we must lift the restrictions gradually, and at least 75% of Quebecers over 18 years old need to be vaccinated. The vaccine is essential to have a great summer, so we must continue all our efforts. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. We will begin the question period. Question. Hello. I would like to have some details on the Johnson & Johnson vaccine and on the AstraZeneca, and you'll understand that they go together. I know that for the Johnson & Johnson, you're waiting for approval for use, but can you guarantee to Quebecers that they will be able to choose it or not, as is the case with the AstraZeneca? And for the second dose of the AstraZeneca, is it the same thing? We're waiting for the recommendations, but is there already a possibility that somebody who doesn't want to get a second dose of the AstraZeneca can get another vaccine? Well, all of this is being evaluated. You'll understand that the principle, and I think the minister can complete, the principle is that people will know what they get. For us, it's very important. We call that informed consent. We will not hide what vaccine dose you're getting. If it's Johnson & Johnson in a clinic, then it will be disclosed. Now, for the question of the interchangeability of the vaccines, for the moment, it's still being studied because we need to make sure that it works, that it's as beneficial, if not more. So for the time being, we will wait for the recommendations. But I would say with more vaccines, we didn't have a lot of vaccines at the beginning, but when we have more, potentially there will be this type of thing that will be possible. I'd like to hear you on the vaccine passport. I know that there's a lot of evaluations that are ongoing, but there's a lot of conversations on the question of the passports. Ottawa is saying that we're probably going to have a passport to travel in Quebec. Can we expect, even if we know that perhaps we don't have all the pieces of the puzzle, but can we expect that we will have to present some form of passport, of vaccine or vaccine proof to go into festivals or businesses? Is this something that's possible at this stage of the game? I will repeat again, we are not yet there. We're not. What we've asked, the whole question of the use of the passport, we've asked public health. There was a first opinion that was rendered by the NSPQ a couple of weeks ago, but we asked public health to give us an opinion on this. But in the meantime, and as I had committed to several weeks ago, I said my concern is to give digital vaccine proof. So I had a meeting last week. I really like what I saw. So a QR code that would be available with the necessary information. So the technical aspect of vaccine proof is going forward quite well. Now, what I would say, to not give people false hope, is that we have to make sure, and we want to well understand, that it would be after the second dose that this vaccine proof would be available, because in order to be fully vaccinated, we need both doses. What I saw last week was very encouraging. It follows everything that we're doing in our Carnet Santé, with our platform that's going quite well, the platform that we use for Click Santé to reserve appointments. So to create a link with a QR code, I'm not going to say it's easy, but we've got people who have worked on this, and what I saw last Friday means that when we will have the need to issue a vaccine proof that a patient or a Quebecer has received 2 doses, we'll be ready to do so. So that is no longer an issue. Technically speaking, we'll be able to deliver the merchandise, and that's very good news. But on the question of how and when we will be able to use it, well, I will let people from public health get back to you on this in the next few weeks. But we're moving forward. We're progressing. Question? Hello, Mr. Legault. I would like to ask you a question on the resignation of your minister, Mrs. Proulx. In February 2020, we knew that there were some allegations of harassment within her office. I would like to understand why it took so long before Mrs. Proulx resigned, and why did we wait so long before acting? Well, we got some information last year that there was a difficult working climate in Marie-Ève Proulx's office. We met Marie-Ève Proulx. We provided services. She was coached, and unfortunately, we are realizing that the situation has not improved sufficiently. So Mrs. Proulx has given in her resignation as a minister today. She is remaining in M&A, and we will do some follow-up for the staff in her county office. Now, concerning her staff, the staff in her office, she is remaining in the caucus. How can you tolerate that a minister who is subject to such allegations can still be a member of your party? Well, listen, what we are seeing is that there's some work to do to improve her management of employees. I'm told that the situation is relatively good in her office, and we will follow closely this situation. We will make sure that we do a follow-up, because for me, it's not negotiable. Everywhere I've worked in my life, whether it was when I was president of Air Transat or since I've been in politics, we can have high expectations, we can work hard, but it must be done respectfully and with good humor. It's important that we have fun at work. And for me, an organization, whether it's private or public, is like a small family. Everybody has to be careful. So that's not the kind of climate that I like to see. Question? Question on vaccination. So at the pace that it's going, most people will have their appointment even before the date that we had set, so before the 24th of June. Perhaps we're even talking about the first week of June. And with the doses that are available, what about for the vaccination of the 16 and 17-year-olds? Could that start in June? And actually, we're waiting. The FDA should next week talk about vaccination of the 12 to 15-year-olds, and usually Canada follows. So what will we do with that age group? If you'll allow, I will answer the first part of the question, and Dr. Arruda can complete. What I would like to say today is that it's obvious that what's going quite well right now is that we have a lot of vaccines coming in. And, you know, we've got close to 450,000 Pfizer coming in every week for 5 weeks. That's major. So you are right. If Quebecers go get vaccinated, and I want to get the message through, we still have some appointments for this week. When people reserve, the people from 45 to 49, which started yesterday, we had a first big day where approximately 168,000 people took appointments. I've got a little bit less than that today, but we still have some space this week. I look at the next 7 days, we still have 20,000 spots to get vaccinated in Quebec. Some regions don't have any, but in some regions they have. So it's nice to have the vaccines, but people have to come to get vaccinated. The good news, when we are at 3.1 million vaccines of first doses, if you add 2 million vaccines, it's true that at 5.1 million, we will be very close to our objective of 5.3 million. But for this, Quebecers have to be there every day, every week, because we can vaccinate 450 to 500,000 vaccines or people a week, and even more with the Moderna that is now available. So to the first part of your question, it's true that it could finish before the 24th of June, but for that, Quebecers have to come and get vaccinated. And as the Premier said, if we surpass our 75% target for all categories, so every time that we open up a category, like for tomorrow's, so tomorrow it's 40 to 45, opening up tomorrow morning, well, I would say to people, and there's some who did this last time, they go look the night before they go to bed, because sometimes it opens a little bit earlier. So make sure that you go book your spots so that you can be among the 200 and 250,000 who will reserve over the next few days. And for the rest, I'll hand it over to Dr. Arruda. The Canadian Committee and the Quebec Committee are looking closely what's happening in terms of approvals of vaccines for younger people. We know that Pfizer probably very soon, they'll have the authorization for the 12 to 15-year-olds. So we have to understand that we are already working with the Ministry of Education to see, and according to the doses that we'll have, of course, to see how we could vaccinate these people. If the vaccine is available for 12 to 15-year-olds and more, then that would be a possibility. But we will wait to hear what the SIC says. But we're getting ready. One potential scenario is that a first dose could be given in the summer and a second dose at some point after back to school, which would protect students 12 and up in high school. Follow-up question, Mr. Legault, you open the door to next steps by saying soon perhaps we'll be able to have dinner parties, restaurants can open gradually, but you put the emphasis on the 75% vaccination rate for a first dose. But there are other jurisdictions in the world where they've allowed some openings with rates that are lower, for example, 44%, 45%. Is it absolutely 75% that we have to reach in order to hope opening things up, or could it be done sooner? Well, listen, that's the type of question that I ask at least once a week to the people of public health. Where's the bar? So there's a rate of vaccination, but what I've been told, what the experts tell me, is that the situation of transmission. So how many cases do we have? How many people are in a hospital? So it's not just the percentage of vaccination. So I, too, would like us to be able to open up more before we reach the 75%. But I say to myself, if Quebecers, if we aim for 75% in each age group vaccinated by June, well, the chances are very good that we'll have a wonderful summer and we'll have wonderful answers from Dr. Arruda. Question. First, Mr. Legault, I know that you're a hockey fan. Yesterday, Cole Caulfield, he was on fire. I agree with you. It was wonderful to see. Suzuki as well. Nice pass. So honestly, a young guy who is just full of positivity. Exactly. Do you have a question, Mr. Lapointe? That's just my intro to my first question. When do you believe that Quebecers will be able to go see these players in person at the Bell Centre? Are you in discussions? Could there be a permission given, for example, to professional sports to have some fans in the stands? Well, before I hand it over to Dr. Arruda, I want to confirm that yes, I've talked about this several times with Dr. Arruda. Imagine last night if we had a sellout crowd at the Bell Centre for Cole Caulfield's goal. It would have been unbelievable. But I'm sure that we've all heard that. It's a very good question. I've asked this question several times, and I'm waiting for the answer. There are some discussions, not discussions, but we're thinking about the increase of the vaccine coverage and the advancement and the control of outbreaks, which would allow to reopen to audiences. Perhaps it wouldn't be a full house in the beginning. There would be fewer people in order to respect certain distancing principles, but it's something that we haven't eliminated completely. And some people will be able to go have fun in person instead of at home. Can we have an order? Can we know when? A date? No, I won't give you any date. There's still some discussions to be had. But that's why it's important. Now, all of these things, these kinds of activities, like this one or others, they will be doable if our rate of vaccination increases. The more we've got people vaccinated, the lower the chances of outbreaks. And so, truly, that is dependent on the efforts of all Quebecers. For the time being, we're still in a fragile situation. There are some zones that are at high risk where there are outbreaks, and we have to be careful. So we can't let go completely. And if you go from emergency measure to red, don't think that it's orange or yellow. Respect the rules, get vaccinated, and together we will be able to go back to a more normal life if everybody's on board.
Oui, mais sans relance cette fois-ci.
Question. Like several countries are doing right now, have you mandated somebody in your caucus, Mr. Legault, or perhaps Minister of Health, to prepare a law on the return to normal. In France, they call it a law on the management of the crisis. Are we preparing that kind of approach now? I've asked, and Christian's working on this, I was saying this last week, it's a sequence. What is the sequence of events to go back to normal life? In what order will it occur? And that is what we're working on now. That's what Christian's working on now. Question? Mr. Legault, we heard you repeat this. It's a gradual reopening. How do we deconfine more in Quebec when we don't yet have an idea of the impact of the opening of the schools? Well, there's some latitude there. First of all, the experts. Well, first of all, we see that the hospitalizations have decreased. Second, the experts tell us we expect a decrease in hospitalizations over the next few weeks, given the number of cases that we've had in the past few weeks. So that gives us some latitude, and it allows us, with public health, to open up a little. More broadly, we see European countries who have a vaccination rate that is less significant than ours and who have more cases per 100,000 inhabitants who are starting to reopen. What is the important factor? Why do they deconfine more? Why are we waiting? And why is it by region? Well, the healthcare systems are not all the same. We have to look at our specific situation, the outbreaks, the environments, etc. Of course, there are different experiences elsewhere. We've seen some people ease up and then they had to retighten the rules. So it's a question of risk management. All of this is a question of risk management. We wanted to give priority to students, children. We know that with the schools, perhaps there'll be an increase in cases, etc., but perhaps it won't have the same impact that we've seen in the past. And I want to take this opportunity to tell you that this afternoon at 2 p.m. there's going to be some of my opinions that will be made public because you've asked for this. Some of my opinions will be made public and they will be added to the 14 that were already published. Did you want to mention something on these opinions, Mr. Arruda? No, I just wanted to tell you that, as we had said, they will be on the ministry's website, and you'll be able to consult them. Obviously, the opinion from today is not there. Question? I want to come back to vaccination. You brought up different age groups, the possibilities that perhaps there's some hesitancy in certain age groups. Do you already have an idea of the times in the vaccination campaign where it might be more difficult to reach Quebecers? Up until now, no, I wouldn't say there is hesitancy. We're keeping an eye on it because, as I've explained, we're able to see with the information that we now have, which is almost in real time, to follow how fast people take appointments. That's why I put it on social media. Up until now, the new age categories that we opened as of last Friday, they filled up quite nicely. For example, what I said this morning is that we already have reached the 75% for the 60 to 65 age group. There's only in Montreal where we're a little bit below that, but we're talking about 10,000 vaccines. 10,000 vaccines on the island of Montreal is not much, but I mention it because every time what we have to do, we have to be able to beat our 75%. The 75% that we had given for the 24th of June, for me, that was a minimum. So every time that in each one of the age categories, exactly like the Premier said, we want to be able to beat each category that we open. That's why we're going to keep people informed of this. But I'd like to remind you, and I take this opportunity, the Premier had said that April was going to be a very dangerous month, and I think that we succeeded quite well in April. And I would tell you that May is a month of vaccination. If there's something to take away in the next few weeks, it's to take advantage of these 2 million Pfizer vaccines that we've got. It's an incredible opportunity. You'll remember a little bit more than a month ago, we thought that we had only 1 million vaccines. Now we've got 2 million, and that is an unbelievable opportunity. Daniel Paré was talking to me about this yesterday. We can accelerate the second dose throughout. There's all sorts of strategies that we're looking at, but I want to know at what pace Quebecers who have access to the vaccines up until next week. How they'll take advantage of this, and then we'll be able to readjust our strategy in order to administer the second doses. So the focus for the next few weeks is to take advantage of the adjustments that we make every couple of days so that May can truly be the month of vaccination. Mr. Legault, I wanted to come back to the resignation of Mrs. Proulx. If we include you in the calculation, your caucus is no longer in the parity zone. So what do you want to do to adjust this calculation? Because you had promised parity in the caucus. Well, nothing's been decided for the time being, but it's not impossible that we will do something in the next few months in order to come back to parity.
Patrice Bergeron, La Presse canadienne.
Question? To clarify, Mr. Legault, you and your caucus, have you asked Mrs. Proulx to resign, or did she offer to resign without anybody in your entourage asking her? Well, let's say that we came to an agreement. It was a common agreement. And you said that it's zero tolerance for you, and this was almost tolerance 15 for Mrs. Proulx. Now, what did you know about this whole story since the start? Did you know something about this since the beginning, since there were rumors about this? Well, listen, last year we saw that there were some people who resigned. There's many reasons to resign. Perhaps it's because we take a better job somewhere else. There could be all sorts of reasons why people resign, but I heard last year about the climate that was difficult. And you know, I have experience in the private sector, and it's not always obvious to manage people. And that is why we said we will offer Marie-Ève some coaching. A coach will be able to help her to better manage her staff. Unfortunately, it didn't deliver the results that we expected, and I came to the conclusion that she cannot remain in her position.
Bonjour, monsieur.
Question? Concerning vaccination, Mr. Dubé, you had already given us a number on the lost doses, sometimes for all sorts of reasons. Do we have an idea of the lost doses to date? And how can we make sure that at the end of the day, yes, there's a recall list, but how can we make sure that we're not wasting doses? Well, listen, that's a good question. I don't have the exact number in front of me. I will check, and I'll get back to you, perhaps during the next press conference. But we have succeeded up until now, because I know that several of you have visited our different vaccination sites. The equipment that we have to make sure that we don't have any losses is very good equipment, and we have adjusted. So waste, it's very minor. I was telling you, I think the last time, a couple of weeks ago, I had told you approximately 200 doses. I don't know what the number is now, but I could check. On the question as how do we use our recall lists? Well, I would tell you that we have even more flexibility now, because we don't need to make sure that we check with health professionals. There's so much demand and so many vaccine doses. I don't think we have any issues finding the right people to vaccinate. But one thing is interesting, though, and I'll end with this. If today, when we vaccinate 80 or 100,000 people a day, it's normal to have 2 or 3% of people who don't show up. It's unfortunate, but that's the way it is. With Pfizer, what's great is that these vaccines stay in the freezers, and we just delay them by 1 day. So there's less and less waste. Mr. Legault, we heard restaurant owners asked to be able to open their terraces, to take advantage of the summer and enjoy a sangria. So we were talking about red zones and orange zones. Can we start dreaming about perhaps finding ourselves on a terrace one day? I didn't ask you to ask that question, right? I love to give you hope, and yes, I do think that it's something that will happen. But again, here we're talking about things that could be outside, right? Events that are outside. We have to talk about a population that is vaccinated adequately, no introduction of new variants, all of this. And that is why I tell you that I understand that people are truly fed up. But if we put you in the red, you're not in orange yet. So please respect the measures for the red so that we can one day go to orange, because every dose of vaccine administered, it increases the immunity. So, and let's hope as well that we will get virus seasonality, which could also be a factor to decrease risks. If I may answer, the big doctors that you had the opportunity to speak with Dr. Arruda, Dr. Massé, Dr. Lidvac, what they always tell us is that there's a balance between the sanitary measures and vaccination. The more we can increase vaccination, the more we can adjust the measures. So do you see what I'm saying? If we want to remove measures, what do we need to do? We need to increase vaccination. So I'm repeating myself. It's really a balance between the two. The month of May is a month of vaccination. Question? Hello. Yesterday, some members of the Immunization Committee made some comments. Dr. Quash said, would you take the risk, even if it's at 1 out of 100,000, to have a vaccine for which there would be a severe complication? Or if you know that in 2 weeks you can get an mRNA vaccine, would you wait for it? What is your message for people who have made appointments for AstraZeneca in the next few days or who will get a second dose? Are they better off waiting? Do we still need AstraZeneca given all of the Pfizer doses that we're receiving? I'll start. Well, first, we've always said that we need informed consent. We've got 30,000 doses left of AstraZeneca, and if I include the first phase, it's more than 500,000 doses that we've gotten from the AstraZeneca. So if people do not want the AstraZeneca, nobody is going to force them. But I would tell you still that there are some people, and again yesterday, who booked an appointment knowing that they would get an AstraZeneca. So there are some people, for all sorts of reasons, after having consulted their doctors or whatever. But like I said, we're not in the same situation anymore where we were close to 2 months ago, where we said you have the opportunity to get the AstraZeneca today in the category 45 and up, or to wait 6 to 8 weeks. We're no longer in that situation. I will let Dr. Arruda complete the answer. We have to understand that it's a question of risk management. The risk of getting COVID-19 currently, with the rate of transmission in Quebec, it's still present, right? So at some point, you could find yourselves, you could get an embolism or blood clot because of COVID. So it's a question of risk management. And currently, we consider that at this stage of the game, it's true here and even truer in other provinces like Ontario and Alberta. But the use of AstraZeneca is still indicated. We're not going to force anybody, as our minister said. But I think that at some point, if ever there was another epidemiology and at some point there's other types of vaccines, well, it's possible that this vaccine will be not as used, but it still remains a wonderful instrument, in my opinion. I don't want to negate the 1 out of 100,000. We had 4 cases to date, including one that remains to be confirmed in Quebec, which is below the 1 out of 100,000, or above it, sorry. So it still remains a question of risk, and there are many people who prefer to be protected today against COVID-19 because they are exposed elsewhere, etc. Perhaps I would add, I'm not an expert, but I will tell you, I'll give you a few numbers that spoke to me, a few numbers that I heard from experts. So a person who does not get vaccinated has 28 chances out of 100,000 of having a thrombosis. Somebody who gets AstraZeneca, it's 29 out of 100,000. And a person who takes the pill, the contraceptive pill, it's 98 chances out of 100,000. So if you take the contraceptive pill, you add 70 chances out of 100,000. But if you take the AstraZeneca vaccine, you go from 28 to 29, not 28 to 98. So yes, the 1 out of 100,000 is worrisome. And I could give you numbers if you take your car, if you whatever. There are not many things in life that we can do without any risk at all. Of course, 1 out of 100,000 is a lot, and it's not at the same time, but we have to be informed. I don't know if that helps, but on another topic, we heard yesterday that in certain Montreal hospitals or anesthesiologists who delayed the beginning of certain surgeries are not satisfied with the salary cuts that were imposed by the Institut de la Pertinence. What do you think about this, given the context of the delayed surgeries? Do you have a message for anesthesiologists, and what will you do concretely beyond the letter from Dr. O'Patterney? I told you earlier that I was very pleased with vaccination. I'm really not pleased with the situation with the anesthesiologists. For me, it's completely unacceptable what they've decided to do after we asked them clearly last week to not do this. Here are the facts. In 2019, we negotiated. I was there during the negotiation with Dr. Francoeur. I was at the Treasury Board then, and you'll remember in what situation the specialists were at the time. The population was very uncomfortable with the salaries that were being paid. We negotiated an agreement that was difficult to obtain, where there was, amongst others, the Institut de la Pertinence, where we negotiated with the different associations to remove bonuses which were useless. You know, there was all sorts of bonuses for showing up on time and for wearing a white coat and whatever. That's one of the bonuses that was discussed. You know, showing up on time, paying people to show up on time. There's a lot of people who would like to have a bonus to show up on time at work. So to summarize, the Association of Anesthesiologists decided to not respect the agreement from the Institut de la Pertinence. So I asked the new president, Dr. Olivar, I said, listen, this is your responsibility to have this agreement with your anesthesiologists, and that is what Dr. O'Patterney clearly indicated, that it's up to him to get the agreement respected. What I said to the anesthesiologist is, let's be very clear. We are improving our situation in hospitals so that we can take up surgeries again. Now is not the time to cut the hours in the surgery rooms, in the operating rooms, to operate people who are on waiting lists. I'm not sure that the anesthesiologists have understood the severity of the situation, to be very clear. I agree 100% with the Minister of Health. It is completely unacceptable. And we'll remember that we were very clear that there would be adjustments to the compensation of specialist doctors. We had an agreement with the president of the FMSQ, and that agreement must be respected. Question?
Bonjour.
Hello. Last week, Dr. Arruda, I asked you a question on people who are immunocompromised. When it comes to the delay of the second dose, you said that it would be reduced to 4 weeks. So when will you offer this second dose, and how will you proceed? Well, it's going to be offered. Usually people who are immunocompromised, this is managed by the clinicians, either pharmacists or in hospital settings. So these people will have their appointment moved up. Mr. Dubé, perhaps you can answer the question. I got several messages from people who are immunocompromised who contacted their health establishment, their doctors, and there was no way for them to get that second dose, even if they've been waiting for more than 4 weeks. So I'm wondering, Mr. Dubé, when it comes to the healthcare system, how must these people proceed in order to get this second dose? Well, like Dr. Arruda, I would love to give them an answer, but I have to be able to, I have to follow the opinions that were, I'm waiting for the opinion, actually, and I will act very quickly once I do have the information. We will now go to the English questions.
Good afternoon. Can you hear me okay?
Yes.
Okay. Premier, my first question is for you, and it's about immigration. We heard we heard some comments that you made recently about wanting immigrants to come here who earn a salary that is more than $56,000 a year, and you said that accepting immigrants that earn less than that just aggravate the problem or make the problem worse. Some people feel like you are blaming immigrants or putting the responsibility on immigrants themselves. Do you want to clarify at all this message that you had, or explain maybe in more detail what you meant and what your vision is for immigration?
Okay. What I said is two things. Right now, we receive about 60% of immigrants that are part of what we call economic immigration. 40% are coming from the group refugee and family reunification. So what we would like is two things. First, we would like to increase the 60%, so have a higher percentage for economic immigration. And second, we would like that within the economic immigration, that we target first people having the diploma and training to get to jobs over the average salary. Right now, we have in Quebec 32,000 jobs that are paid more than the average, so more than $56,000 a year, that are available. So what I said to Nadine Giraud and Mr. Boulet is that we first get to these people.
Madame Anglade spoke about this morning, and she says that this is not a realistic vision of immigration, that there's a labor shortage in Quebec. We need more immigrants, but all kinds of immigrants to come here. And she was questioning your vision. Do you think it's short-sighted to focus on just the largest earners as opposed to other people, because there's a labor shortage everywhere?
But what we can see is that there's a very important difference between the liberal approach and our approach. Our approach is to increase the percentage of immigrant being economic immigration, and our second target is to get first the people earning higher salaries, which will be the ones having the most diplomas and training. So it's a different approach. I know very well that the Liberal governments, it wasn't important for them, those two criteria. It's very important for me.
Katsune, CBC.
Good afternoon. I heard your answer in French, but I would like to hear what you have to say in English. What do you say to Quebecers after the National Immunization Committee suggested waiting for another vaccine rather than taking AstraZeneca or Johnson & Johnson? It created lots of confusion and also frustration. So what do you say to Quebecers?
Well, you want to repeat what I said in French?
Well, not necessarily, but regarding the fact that the National Immunization Committee yesterday said you can wait for another vaccine if you get the choice you have is AstraZeneca or Johnson & Johnson. It created confusion and also frustration. So as of now, since we do have still AstraZeneca's doses.
Maybe what I can do is I can start, because I think there's two issues here. What we told the people when we had twice we had the offer of AstraZeneca. Remember, we had about 100,000 2 months ago, and then we had the 400,000 batch. I think at that time we said very clearly to all Quebecers, this is your choice. You made an informed choice. You can wait so many weeks and take the risk of, especially when you're 45 and up, you have a risk of waiting, and that risk is to catching the COVID-19 during those number of weeks. I think a lot of people, informed people, that take the right decision, because this is one of the reasons I think we have this third wave. I'm not saying this is the only reason, but this is one of the factors that has quite a big impact on the way we're managing this third wave, because we were able to add roughly 500,000 vaccines. This is huge. So but we gave that choice to Quebecers. I think what Dr. Quash had said, she had made the reference now, the number of weeks is smaller. I think that's the only thing she said. And I would suggest that people will take the decision that maybe they don't want to wait 2 or 3 weeks and don't take the risk. It depends on your own choice. But I think, and I think we all respect Dr. Quash, and I think that's what she said. But the factor, the key factor that she explains, the factor of time. But that time was much longer 3 months ago or 2 months ago than it is right now, given the choice that we have with Pfizer. That's my personal understanding of the comment she made yesterday.
Okay.
In fact, I just want to say that the benefits from the vaccines are very higher than the risk of complication,
Exactly.
which is there, which is not zero. And we've always been transparent about this. And I would like to add, because there was people calling about Chaudière-Appalaches, understanding what's going to be read and everything. There is, because I've received some people asking me to make it more clear. Only Robert Clich, Beauce-Sartiguan, and Lac-Etchemin are going to stay in emergency measures. All the rest, les Appalaches, Lotbinière, la Nouvelle-Beauce, Lévis, Bellechasse, Montmagny, et Lillet, they are going to get red. So that's to make that clear, because
Granite also.
Huh?
Granite.
And Granite is on the street, is going to stay in emergency. But I was talking about Chaudière-Appalaches.
Okay, sorry.
OK, juste un moment, on va vous demander de répéter ça en français,
Oui.
s'il vous plaît.
Oui, excusez-moi, on m'a demandé de clarifier.
I was asked to clarify some things for this, the MRC, Chaudière-Appalaches. The MRCs that remain in emergency measures are the Beauce, Sartiguan, les Etchemins, and Robert Clich. All the rest goes to red. So Appalaches, Lotbinière, Lévis, Bellechasse, Nouvelle-Beauce, Montmagny, Lillet, that all goes to red. In the Estrie region, we add the Granite as being, and it's next to Beauce-Sartiguan, and they're going to be in emergency measures because people wanted to have more details on this.
Premier Legault, I would like to hear your explanation on Marie-Ève Proulx. A colleague of mine just did an interview with the ex-mayor of Montmagny. He worked at her riding office while 2 employees were on sick leave, and he's not surprised to see what's happening right now. Did you wait too long to act because she's a long-time party faithful for the CAQ?
No. Last year, we heard that the climate, that the working relationship at her office wasn't good. So we met her. We also gave her a coach, so to help her. They told me that it improved at his office as M&A, but it didn't improve enough in her ministry. So I met her this morning, and we agreed together that she will resign as a minister, but she will remain as an M&A, and we'll have a follow-up. So I have somebody from my office that will have a follow-up to make sure that at the office in her riding, that the climate is good with the employees.
Samuel Pouliot, CTV.
How is it looking now for the confining for this summer for places like Bell Center for fans? How do you see the summer and the confinement?
You're passing the puck to me, and I'm not Cofield. I think we'll answer that over the next few days. I think it's we're working on a plan right now, and I think it's a bit premature to talk about it today. But I think we're we've been asked to present something in the coming days, so I would prefer to wait and give you that answer.
Regarde, moi, je suis dans le but, hein, je suis dans le gardien de but. Je dois savoir l'époque.
And Dr. Arruda, about the vaccines, what are the chances of mixing vaccine, especially AstraZeneca, the second dose?
With another type of vaccine?
Yeah.
I think we still need to get more specific data, but I think there is a high probability that it will be possible. But we will just see what is going to be the response. Will it give a better response, a very low response? That's something that needs to be studied by science.
Philippe Autier, The Gazette. Good day. Question for Mr. Legault, because I know you follow the situation at airports very carefully. There are reports today that nobody is giving fines and tickets to people who refuse to quarantine at Dorval Airport, at the Montreal airport. Have you heard any of this? And is there anything that can be done about that? Because they're giving tickets to people that are flying into BC and other airports, but not in Montreal. Are you aware of this?
I'm not aware.
Check that.
I don't spend as much time with airline and aircraft.
Yes, I know,
as in the past.
but you follow what's going on in the other provinces pretty carefully.
Yeah,
So,
I heard
Okay.
Doug Ford saying it.
yes, perhaps you can check on that for us. A question for Dr. Arruda from a colleague of mine. Do you feel Quebec will be able to achieve a herd immunity from the COVID once we have enough vaccination out there? Or will we always be in a situation where we have to battle against the disease, the virus?
It will depend how the virus is going to mutate or not, and it will depend also what kind of variant is going to be circulating, because herd immunity is related to the characteristic of the virus sometimes. Like for measles, you need 95 for getting herd immunity. So it depends the level of control of the outbreaks. But I think that with the vaccine, especially with a second dose, we will be in good condition to lower the rates and lower the impact of the disease in Quebec as elsewhere in the world.
Is there a minimum number that you need there?
There is a lot of different people are talking about 75, others are telling 80. It's very difficult to have an exact number actually, because we need to have more information about different cycles of the disease in years.
Bon, puisqu'il reste quelques secondes, je vais poser une question, une des nombreuses questions que la Tribune de la Presse a reçues. Avec l'annonce de la
With the announcement of the reopening of La Ronde on the 22nd of May, including the restaurants, the new Association of Quebec Bars have put into question the seriousness of the government, whereas restaurants and bars in red zones must remain closed. What do you answer to restaurant owners and bar owners who think that this decision is contradictory and unfair?
Il faut comprendre que
We have to understand that amusement centers or amusement parks that are outside are also subject to different rules. And in the decisions that were adopted in Quebec, we didn't say that in the red zones they would be closed. And that's one of the things. And within the establishment, if ever, they can't have meals served elsewhere. There won't be meals served in these zones. But currently, you'll understand that the parks that don't move around, right? They were always open, even in the red zone last year. And that is what explains this. But we are also working actively, as we said, to be able to give some leeway to restaurants with terraces, etc. Thank you very much.